Good afternoon, everyone, and I want to thank Senators Casey and Hirono for joining me. Now, 2020 was a year that was full of bad news for the country, but it's coming to an end with some good news, very good news. Over the past 8 to 9 months, scientists, biochemists, and researchers rushed to produce a safe and effective vaccine to the COVID-19 pandemic, and they've succeeded in an amazing, extraordinary way. We don't have just one, but several candidates for a vaccine, each of which has shown to be 90% effective in clinical trials. Yesterday, America crossed 2 milestones. The first, a grim one. 300,000 Americans' lives lost due to COVID. The second, a crowning scientific achievement of the 21st century. The first COVID vaccines administered from one end of the country to the other. It was an amazing sight to see the first American inoculated against the disease, a nurse at Northwell Hospital in Queens, in my home state of New York. Actually, Northwell is on the Queens-Nassau County border. I don't know which part of it she was in. It was an amazing sight to see the first American inoculated against the disease. And over the next year, we will see this replicated hundreds of millions of times as Americans get vaccinated. Public figures at all levels should be building confidence in a vaccine and fight disinformation of those who undermine it. At the moment, the vaccine is being distributed to medical personnel, doctors, nurses, frontlines workers, and the most vulnerable populations. And as I said yesterday, I will take the vaccine as soon as it is appropriate and recommended. I will not skip the line. So, the COVID vaccine is light at the end of the tunnel. It's getting brighter every day. We have a long way to go, but we can't think that the crisis is over. We need to pass COVID relief to help our fellow Americans get by until we eradicate this virus. We need to fully fund not only production of the vaccine, but its distribution as well. The states badly need that money, and we need to get it done for every American. Senator Casey.
I want to thank Senator Schumer and Senator Hirono for joining us. As much as this year has been a challenge on so many fronts regarding first of all, regarding the worst public health crisis in a century, we still have more challenges ahead, not only in the next few months with the number of cases and the death numbers rising, but also we face a challenge with regard to the distribution of the vaccine. We're very happy that we're at this point and that we can talk about the vaccine being distributed as opposed to just being developed and hoped for. But I think we need to do at least two key things. First, having more funding for state and local governments to distribute the vaccine and conduct mass vaccination campaigns on a scale that is unprecedented. So they're going to need help doing that. We need also to instill confidence in the vaccine among the public. You've heard a lot about that. I know that in my home state of Pennsylvania, officials there have talked about the need for more funding for this effort. It's going to take billions of dollars, and the federal government needs to step up and pay the tab to get this done. In terms of building confidence, we all, I think, have a role to play, talking to friends and family, but also those that might doubt whether or not they should take the vaccine. There are others, some who will be better messengers than others, but we all have to do our part. We need to make sure we're sharing, especially elected officials, sharing accurate information from trustworthy health experts to answer the questions that people have. Some have made the point that not only do we need to talk to people to instill or increase confidence that folks have in the vaccine, but we also need to listen to what those who have doubts are saying. We can't simply lecture to them and hope that they fall in line and get the vaccine. But I think we're going to have across the country a lot of validators and trusted sources, in addition to the health experts, other voices that will get the point across. But I think in terms of what our work has to be, we've got to provide adequate resources so that states have the necessary programmatic support that they need to get the right message out. But it's a time to be hopeful, even as we're vigilant in the next couple of weeks and months because of the rising case and death numbers. Senator Hirono?
Thank you. Leader Schumer and Senator Casey, thank you so much. Yesterday was really a red letter day. It practically brought tears to my eyes to see all these frontline healthcare workers who have been seeing death and suffering for the last 9 months or so to get their vaccinations and how happy they were. So the hope in their eyes, the stories they told, really gave me hope for the country. But as mentioned, it's not over yet. As you know, we're still dealing with an emergency COVID relief bill. And in a state like Hawaii, without the support for state and local governments, the governor has already announced furloughs for basically every state employee. And that's adding to the suffering that's already going on. Then what was mentioned was we're going to need to provide federal support for vaccine distributions. For Hawaii, the first hospital that's going to get these doses is Queens Hospital, one of the largest healthcare providers in the state. It's going to cost the state of Hawaii something like $25 to $75 million to distribute this vaccine. And Hawaii, I just noted, is already furloughing their people. So while there's hope on the horizon, we have a lot more to do to enable the vaccination to be distributed to all the groups and communities that need them, which gets me to the second point. You know, we need to encourage, and this is where the media comes in, we need to encourage communities and individuals to get the vaccine when it is their turn. And we all know that minority communities are already suffering from the pandemic disproportionate. In Hawaii, it would be the Pacific Islanders. These are communities that we have to make special efforts to reach out to and basically to utilize their trusted community people to get the word out that they should get the vaccine. So there's some very specific things that we have to do to make sure not only that the vaccine gets distributed, but the people who should get them will get it. And then we continue to need to do our individual responsibility to wear masks, wash our hands, do social distancing, because we are not going to get to anything that can be described as crowd immunity until sometime next year. So thank you for your part in getting the word out. Mahalo.
Thank you, Mays. Questions for any of us?
What does it say about our country right now that Vladimir Putin acknowledged the reality of our election results before the leaders of the Republican Party?
Well,
and the
look,
Senate?
so Leader McConnell today said that he acknowledged that Joe Biden will be president, and I am told he also, at his lunch with some others, urged members to just go forward, not to mess around with the Electoral College or any shenanigans. I hope very strongly that that happens. It's over. The Electoral College has said Joe Biden will be the next president. Every Republican should acknowledge that and stop the games, and those in the leadership should encourage fellow Republicans to do it. Yes.
Leader Schumer, is the $6 billion in the bipartisan proposal for vaccine distribution enough? And are you willing to set aside state and local to get the rest passed?
Let me, on the first one, I think, without talking about what will happen in that room, I think we need more for distribution. On state and local, everyone knows my position. It has broad bipartisan support, and I'm not going to get into negotiations in any way that'll occur at 4 o'clock. Yes.
Senator McConnell last week suggested setting aside liability protections and setting aside state and local, and last week you criticized that. I mean, isn't that where these talks are going right now?
As I said, I am not going to get into negotiations here. That'll occur at 4 o'clock. Yes.
One of your caucus members, Senator Sanders, is still pushing for the individual $1,200 stimulus checks. Is there any chance we could see that this month, or is that something down the road?
I'm not going to get into negotiations in the room, but $1,200 in additional money to go to people is something many in our caucus, including me, support.
Are you confident that there are going to be enough vaccine doses for everyone next year? And should President Biden consider the Defense Production Act, if necessary, to increase the number available?
You know, the fact that he has Jeff Zients and Ron Klain high up in his administration gives me a lot of confidence that the Biden plan to both produce and particularly distribute the vaccine will be a lot better than Trump's plan. Okay, thank you. Oh, yes, last one.
The caucus last week voted on changes to the rules, and I just wanted to see if you might be able to talk a little bit about what the impact of the rules changes might be.
Well, I'm not going to, with the committee led by Ben Cardin, our committee on caucus rules is still meeting, and so not going to comment until they come out with some ideas, if they do. Okay, thank you, everybody.
You're optimistic there'll be a deal?